Good afternoon. For those of you new to attending our webinars, I'm Karen Merrill, LCSW and RBH presenter and EAP provider. And for those of you frequent attendees, welcome back. I'll be spending the next 50 minutes or so looking at grief, handling life's losses. I've included polling questions throughout the presentation, and usually there's time at the end for question and answers. So let's get started. So our agenda today looks at an exploration of understanding what's actually happening and the meaning of grief, loss, and change. We'll look at the stages we experience, and after we've set the groundwork for some understanding, then we'll look at managing our reactions and tips to restoring life balance and to create a sense of well-being. So you've likely heard of Elizabeth Kubler-Ross. Elizabeth was a Swiss-American psychiatrist who actually was a pioneer in the studies of grief and dying. So in 1969, I believe, she wrote a book called On Death and Dying, and it introduced these 5 stages of grief, which provides a framework for us to understand the process, both as somebody might be going through the dying process and then how we grieve the loss of a death or other changes. So we kind of have moved it away from those exact stages that Elizabeth came up with and look at shock, disbelief, denial, anger, guilt, anxiety, depression, and then acceptance and hope of stages of grief. The fact of the matter is that the only way through grief, the only way around it is actually through it. We can't avoid it. It's a process that we have to experience to be able to get to acceptance. And grieving people experience a complex range of emotions and reactions with several stages. It's not a linear process. It's not rigid. So generally, in the beginning, we can be in the state of shock or denial. Then later comes anger, guilt, anxiety. But it doesn't always happen in that stage. You can feel some relief initially, and then you can go into a stage of anger. We can feel a sense of numbness and disbelief initially that actually is a way that protects us from the anxiety and depression of the finalness of that loss. And it kind of has a tranquilizing effect for a period of time. Anger comes from a feeling of being abandoned by someone we love or a situation. We're left to resolve new problems to deal with that we may not have had to before on an emotional, financial, and social level. So it can be a time where we feel stuck while other people are going about living their lives. We can feel guilty about things that we may have said or done or events that happened right before a death. Common to hear people say, I raised my voice at that person not long before they died, or we had a fight. We start to kind of what we call bargain in our heads that if things had occurred differently or we had been different, maybe somebody wouldn't have died. So actually, it's a very important phase of the stages of grief. Anxiety and depression are very common. And as we go forward, we'll be talking about the specific symptoms that we can experience and things that we can do to combat that. And then after time and after accomplishing these stages, then we come to what we call acceptance or hope, where life starts to move into a more normal routine. And we start doing things that we once enjoyed. We realize that there are actually more good days than bad days. The fact is that acceptance is the net result of a healthy grieving process. And that's what we want. We want to be able to come out on the other end with a renewed life. What's it like to grieve? Most of us have had that experience one way or the other because grief is a natural response to any loss or separation. It's the center of a whole process that engages us in adjusting to changed circumstances. So, grief is not just about resolving or recovering from the death of a loved one. We grieve the loss of a job. We grieve the loss of moving from one community to another, leaving behind a way of life and friends. We grieve our kids leaving home and the result in a empty nest syndrome. So it doesn't have to be dramatic to think about what it's like to grieve the loss or separation. And understanding the stages helps us really with any grief or loss. So grief's experienced on a variety of levels. It affects us psychologically through our feelings and our thoughts. It affects us physically through our bodily systems and actually our health. Oftentimes, people who've experienced a tremendous amount of change, and there are scales to measure this, are more likely to get sick afterwards because their immune system is depleted from the stress and strain of grieving. We're affected socially through our behavior with others. Wanting to withdraw or isolate is a common reaction um, to having a significant loss, and that may show up in their workplace as well. So all of these areas are affected through the grief process. So here we say grief is a universal human experience. It's a normal and natural response to loss. It can be awkward and uncomfortable for others based on the individual's unique perception and a necessity, not a weakness. So all of these statements on this slide are true, and yet they seem to contradict each other in a way. For instance, if grief is universal and a normal and natural response, then why is it that we're so uncomfortable? Most of us, if we haven't experienced grief ourselves, know others that do. But each of us is different and we perceive loss differently. So we can't always understand how others are experiencing it. And I think this is important to note about when we're working with others who have experienced grief or loss. We might not be able to understand how they're going through it because we think about it based on our own experiences. So, for example, have you ever wondered why someone who lost a parent seems to be managing so well when you think about how you might be with a similar loss? Well, there's several possible explanations. If that parent had been ill or suffering for a period of time, you might be relieved that their pain is finally over. or the relationship may not have been a very positive one, and it wasn't something that enriched somebody's life that much. So the other thing is that some people are just better at hiding their feelings, particularly at work where coworkers or a boss may feel like it's inappropriate to show their feelings. So if you look at it from another angle, there's really no right or wrong way to grieve. There's no shortcut. It's not a weakness, it's a necessity. It's how we heal and how we move on. And it's important that we do accomplish the different phases so that we don't get stuck. And then that becomes what we call, kind of a pathological grief, or something that is left without resolution. So let's look at our first polling question. Grief recovery is a solitary process. True or false? So polls are open, and we'll give you a couple minutes, and then Brenda will tally it up, and we'll look at how you vote on this question.
So it looks like we have 72% voting for false and 31% voting true.
Sure. Absolutely. It's grief recovery isn't a solitary process. It can be an inclination, as we said, to withdraw or isolate, but support from friends and family and those around us is key. It's the social aspect of reconnecting and getting comfort from others is very important as we move through this process. So moving on, understanding grief and loss. The way out of it is through it. Grief can seem unique to us. It can feel as if no one has had as difficult a loss as we're experiencing at that time. And grief is hard work. It's not easy. It's not the kind of thing that you can sit back and let it happen. It really is a process of feeling those feelings and the complexity and the shifts and cycles from all those stages that we talked about. And effective grief is not done alone. Effective grief is done with the support of others. And oftentimes, the recommendation is a grief support group as a way of being around others that are experiencing the feelings that you are. So we'll be talking more and more about that as we move through the presentation. So myths, mistaken beliefs about grief or loss. You never recover from a major loss such as death. Now, you may not be exactly the same. A major loss such as death, there's a wound and scar tissue, and we may not exactly be the same, but we can recover. And in that major loss, we can put in also divorce and other things that really, kind of shake our core are major losses. Time is the only healer of grief, another myth. Time helps just because we've distanced from the acuity of the event. But if we don't move through those stages, then not just time helps. We've got to do the work. Another myth is that nobody else can help you with your grief. Again, not true. It's not a solitary process. Or this last one, if you keep busy, your grief will go away. Certainly, being busy can act as a distraction, but for those people who engage back into life too quickly, the work isn't done. and it only postpones it. It doesn't mean you can skip it. It means that it'll come back to haunt you if you don't feel the feelings of experiencing those stages of grief and loss. So more on understanding grief and loss. Loss is a fact of being alive. We cannot move through life without loss. As we age, we lose abilities to do things, or the capacity for the amount of energy that we had. So loss is part of life, and grieving is also a result of, of loving and losing. So it's something that it's hard for us as a culture to kind of face head on, but it is absolutely a fact of being alive. And a lack of awareness about it can, as we've said before, impact your physical health and your happiness. If there's all kinds of energy tied up in not experiencing a loss, you're not going to be as happy going forward. And the fact is that we can have a satisfying and meaningful life after loss. It can create, although hard to imagine, opportunities for moving forward in a different way. So these are all come part and parcel with understanding grief and loss. So here's our second polling question. The grief process will be completed by which statement? At the 1-year anniversary? After the funeral? Different for everyone? When our angry feelings subside, or when entering into a new relationship? So we'll give you a couple minutes for this one.
So Karen, we have 100% of the participants voting for C, different for everyone.
Absolutely. Yeah, absolutely. It's a myth that at the 1-year anniversary, grief is resolved. Now, the important thing about that 1-year anniversary is that we've experienced a series of firsts, first holidays, first anniversaries, but it doesn't mean that grief is resolved. And it certainly doesn't mean that after the funeral it will be. Or anger may happen for a long time and intermittently. And entering a new relationship, we've probably all known people that have rushed towards a new relationship as a way of kind of distracting them, but it doesn't mean that that will be a successful one or that it helps resolve the grieving process. I think it actually just postpones that. So you all are absolutely on the mark that it's different for all of us. So to kind of move forward through what we're experiencing, we can see this as endings. The loss creates the end of certain things. Then what we call this neutral zone in the middle, and then hopefully what begins to look like new beginnings or re-entering a satisfying life. Grief and change come with many losses in all kinds of ways that we've looked at. This is a time when we can feel disenchanted and say, it's not fair. It's not supposed to be this way. We can actually feel off balance and disoriented. The expression, you feel like the rug's been taken out from under you. You can feel that way, like nothing is the same. And for changes or loss of relationship long term, you can actually feel disoriented. Who am I without this person? And what am I supposed to do? What am I supposed to do without my old job of all these years, or my old community, or friends if I've needed to move for one reason or the other? So these are the questions and things that come up with that ending phase. What are the feelings around this? Shock and numbness, like we've said, trying to protect ourselves, guilt, what could I have done? Angry about having to face things on their own, or things that are left undone by the loss, sadness and depression. And then sometimes, depending on a situation, there's relief. The pain is over for someone. We're ready for a change. Any number of things can be associated. So, what are the possible responses at this phase? Feeling forgetful, not being able to remember what I came into this room for, feeling angry, being short-tempered. Crying is a very normal, necessary reaction to loss. It's our way of healing. Being absolutely exhausted and not feeling that there's enough energy to get things done. We can be unconcerned about our grooming, not want to get up and shower in the morning, or make an effort to look nice. We can be lethargic, like moving through molasses. We can lose our appetite, suffer insomnia, have unfocused kinds of thinking. So the fact of the matter is, we walk around every day with a certain amount of physical and psychic energy. And if a lot of that energy is taken up with the pain of grieving, the shock of grieving, then we have not as much left. So our focus is diluted from our activities of daily living. So it's absolutely normal to feel these things in response to grief and loss. We can feel, like we're not well, like we're not healthy, dry mouth from lots of crying, repetitive thoughts, almost obsessing about the particular loss. Again, crying as a reaction. A need for sighing, feeling like you need to get more air in your lungs. And I think it can also be a sign of just kind of exhaustion. Overeating or overconsumption of alcohol. And we'll talk a little more about what kinds of things we do to kind of numb ourselves. So that's another common and possible reaction. And what we want to be mindful about is how long we stay in these particular stages before moving on to the next one for fear of getting stuck. So then we've got what we call the neutral zone between the old and the new. The old hasn't entirely been released, and the new hasn't fully evolved. It's a difficult and confusing time with intense shifting emotion, cycles of the phases of grief. I think a metaphor for this is like being in a small boat in the middle of a lake and not being able to see the shore on either side. So you don't quite know whether to turn back and try to get to shore, which we might perceive as safety, or keep rowing towards the other shore, which we can see as new beginnings. So that's what we call the neutral zone. And then the new sapling, new beginnings. Preparation ends and action begins. There's less temptation to turn back. And we start to see a new direction. Things become clear. Goals are easier to think about attaining. And our losses become replaced with new relationships, new connections to a community. And this is really a time for reflection and moving forward and noticing our progress and noticing that, I've been sleeping better lately, or I'm less preoccupied with that loss, or I'm less angry, or feedback from those around you is more positive and not um, a mirror of maybe negative feelings that you've been experiencing. So that's the new beginnings phase. So a word about resistance. We hear sometimes that people are resistant to change. We hear that about changes that occur in workplaces and things like that when we've had a loss and have to kind of get onto a new experience. Well, resistance kind of gets a bad rap. It's actually a natural reaction to disruption. It's our way of combating the fear of danger and pain and uncertainty that we associate with change. We can associate change with pain and status quo with benefit. So it's okay to recognize that we're feeling resistant. It's just really kind of having an awareness about not getting stuck there. And I want to mention at this point, and we'll mention again, that as one experiences the reactions to loss, to know when it might be a good idea to use the employee assistance program to be able to talk one-on-one with someone about what you're experiencing to help, move you through the process. So how do we move forward? How do we deal with this? We actually need to choose to grieve and recover. You've seen people who get stuck and are actually more comfortable at this kind of brooding, angry stage. It's a choice to do the work and to recover. It can be helpful to identify exactly what we've lost. So what have I lost by this death or this change in my job or this move? What is it that I've lost? It gives us a better idea of what we might be looking to put back in our life. And looking at a personal assessment of ourselves. What's our coping mechanisms like? How have we survived loss in the past? And what tools did we use to help us recover? Can be a big tool. Is what have we done before can be useful now. Talking about our loss and our grief. And that's why a support community is so important, because sometimes some people around us don't understand it quite as well as a support community that is much more aware of what that process is like. So facing a loss means accepting and dealing with our feelings and facing the future while learning to get comfortable with the memories of what's lost. So honest communication is helpful in two ways. Actually, it helps express our own feelings, and honest communication can help as we provide support to others. So we all know that, I statements are much more productive than you statements. So kind of being mindful of how we communicate. And when we're talking with others and we're providing support for them, uh, making certain that we're sensitive to them and not say platitudes like, I know how you feel and that sort of thing, because we don't. We never know really how somebody else feels. So sharing our feelings, being mindful, and asking for support in as concrete ways as we can, letting someone know when we're feeling overwhelmed and what might assist us in moving through that. So we've talked about the fact that although it's quite normal and we've all experienced grief, it still makes others uncomfortable as they observe our pain. It can resonate with them when they have had an experience or any other number of reasons why they feel uncomfortable. So finding those who understand our language is important, which is why joining a grief support group is so often a recommendation. After a death, oftentimes hospitals have resources, communities have resources. So when you're faced with this, it takes courage to not run from our pain, just to make others feel okay. So finding people that you can kind of let your hair down with because they've had serious, similar experiences can be a way of moving through grief. The other thing, rules of thumb, avoiding what we call self-medicating, use of drugs, alcohol, food, even, sex, or the use of, burying yourself in the internet and that sort of thing as a way of hiding from what we need to experience. We say that during those first few months and probably up to a year if possible, to avoid hasty decisions, trying to, not move cross country in response to the pain of staying put for a while. Sometimes it's helpful to stay in the environment to be able to process what that loss feels like, particularly when you've shared that environment with someone else. So probably not the time to make major purchases right away or financial decisions. We're not likely to have our best judgment during the acute stage of a grieving process. Trying to let others know what you need and how to help you. We can feel helpless in providing support for others. And we can say, let me know whatever I can do for you or how I can help. If we can say, actually, I could really use a break and, having somebody pick up food or the laundry or whatever that is, really give people tasks they feel like they help in concrete ways. And gathering strength, again, from those around us that we feel comfortable with. How do we restore life balance? There are many ways to do that, and keeping track of it can be really helpful because we can feel like, we're kind of slogging through this process. But if we're mindful of the progress that we're making, then it's a kind of an optimistic way of moving towards regaining our life balance. So there's probably, not a whole lot of new things on these lists for restoring life balance. We say eat regularly, get up, eat breakfast. Don't try to skip meals because that kind of gets us in trouble with the oxygen available to us and our energy. Eating healthy things, being mindful about that, getting exercise, bleeds off stress, only makes us feel better. Getting regular medical care for prevention. So, when some loss or significant change happens, don't overlook yourself or feel like, you're not worth taking care of. Making sure you keep up with physicals and regular testing. And if you're sick, go to the doctor and take time off away from work so that you can feel better. Again, we've talked about being vulnerable physically and emotionally after great loss. So we have to do extra care to insulate ourselves and build our resistance. Physical self-care, getting massages is a way to relax those aching muscles. Physical activity that you enjoy, dancing, swimming, running, playing sports. Sometimes after a loss, we feel like we're not supposed to enjoy life or hear ourselves laugh or, find pleasure. It's very important to engage in activities that are fun. And our loved ones would want us to do that. Being mindful of getting enough sleep, wearing clothes we like and that are comfortable, planning vacations, taking day trips or mini vacations, even if that's, a mini meditation where we transport ourselves to the beach or the mountain. Taking time away, giving ourselves a break from electronics, telephones, iPads. It's distracting to do that. And the one thing that isn't on this list that I would add that's important is drinking plenty of water. We need to be aware of our hydration and our health as we go through this process. So physical self-care in restoring life balance. Psychological self-care, again, making use of the EAP where you have your own counseling. Writing in a journal is a way of venting in an undisguised way as freely as you can. Reading literature unrelated to work, letting go of something causing stress, identifying the things in your life that are causing stress, and committing to letting go of one of those things. Notice how your inner experiences are changing, listening to your thoughts, your judgments, your beliefs. Maybe you notice that you're living more in the present than dwelling on the past or being anxious about the future. So it's about mindfulness and taking care of yourself. So our third polling question: suggestions to ease the grief recovery process are similar to those for building resiliency. Is that true or false? Give you a couple minutes and see what you come up with.
So 94% have voted for true.
Absolutely, it is true. If we were in the room together, I'd ask if there was anything different or anything that we're emphasizing for grief recovery that we haven't heard so much about building resiliency. And I would say that would be the grief support group work is pretty much underscored when we look at recovering from grief other than other kinds of remedies for depression, anxiety, or resiliency. So coming back to restoring life balance, emotional self-care, spending time with others whose company you enjoy. I think we all know the difference between spending time with friends where we feel nurtured and nourished, and spending time with people where we can feel exhausted afterwards. So making the choice to spend time with those whose company we enjoy. Giving ourselves affirmations in the morning, in the evening, praising ourselves for what we're going through and the progress we see. Finding ways to increase our self-esteem as we move into a new life, learning something new, challenging ourselves to do what we've always wanted to, maybe learn a new language or take up a new hobby. Maybe there's a hobby we let go of years ago that brought us pleasure and joy, that this might be a time to take that up again. Sometimes just rereading a favorite book or good movie can be a good idea in terms of restoring life balance. So a study from Duke University found that the behaviors listed above are associated with building stability and a sense of well-being. So cultivating a positive and optimistic outlook. Hanging on to resentment or grudges is a major factor in unhappiness. So being mindful of that. We find that being preoccupied with old mistakes and failures are associated with depression, and preoccupation with the what ifs of the future can be associated with anxiety. So live in the present and be mindful of that. Focus on what you can impact or change, and we know that's not the behavior of others. It's what we have within our control. Have reasonable expectations of ourselves, and I would add to that to have reasonable expectations of others. So, as we move through a grief process, we can get disappointed in the way others relate to us. So, have realistic expectations of ourselves and others. Find inspiration in something bigger than ourselves, whatever that might be, and understand the difference between accepting an unwelcome event or change and not allowing it to define who we are. In other words, refuse to be a victim in whatever's happened, however awful and unfair and unfortunate it can be. So our last polling question: creating a sense of well-being happens in the early stages of the grief process. True or false? Okay. What do we got?
Okay. It looks like we have 97% voting false, 7% voting for true.
Okay. So this might seem kind of like a no-brainer question, but I included it just to kind of underscore the importance of doing the work. There's so much emotional ups and downs and preoccupation and shifting of feelings and experiences that there's not room really to create a sense of well-being early on. It takes moving through those stages before we get there. So just a couple of slides on grief in the workplace. Uh, and the reason we mention this is because we spend so much time in the workplace. It can impact the way we experience our own grief and also in helping others. So when grief and loss finds our way in the workplace, it can be awkward and uncomfortable for all of us. There's issues of confidentiality, there's personal boundaries and productivity that complicate it. We may be supervising others that complicate it. However, the work environment can play a vital role in the recovery. So when someone experiences a loss, sharing our willingness to listen, acknowledging the loss, saying we're sorry for the event, not hiding from it, uh, stating it so that you give permission to that person to be able to talk about it, and even for your own self, if it's been your own loss, to state it. Concrete help in any way that might be comforting. Um, what might be helpful within the workplace in terms of assisting that person and letting the grieving person set the ground rules. We've already said that we're all different. Some of us are more private than others, and others are more forthcoming, but being available to listen, being accepting, and letting that person kind of set the stage for what that might look like. Not knowing what to say in highly emotional situations is common for common for all of us. But it really is important to acknowledge a loss openly and establish contact with a grieving employee. It can be really helpful to make that person re-enter in a way that feels more comfortable. Setting an example of open communication, respecting the confidential nature of that person, and being patient, compassionate as much as we can. Listen more than we talk. Expecting that there are going to be periodic stages of low spirits and not quite as much work productivity, particularly around holidays and that sort of thing. So, kind of being aware of all that and not expecting an employee to snap out of it. I mean, this is a process that we know has a timeline that's different for many of us. So, state as specific things that you can do to help. We talked about that before. And if you're supervising others and you notice the employee's not coping well, showing signs of depression, then reminding folks about the confidentiality of the EAP. That's what it's there for, and it can certainly be a helping hand when we need it. So we've presented a lot of material, and certainly not all of it's new, but we learn by reinforcement. So hoping that it's been helpful, and now we'll open the floor to any questions you might have about loss and change and grieving. So we'll give you a few minutes to see if there's anything you might like to ask.
So, hey, Karen, it looks like we have one question
Okay.
just popped up. So if I were to lose my husband, did you say it would be best to leave the environment that we shared together, like move out of the home where we lived for over 20 years and raised our children in?
So I believe that we need to stay put for a period of time. I believe that you need to live in the environment without your husband for a period of time, because it will allow you to face the emotions and experiences that you shared there and allow you to move forward. I feel like there can be an inclination to run from it and to move from it, to avoid the discomfort. And I think it postpones the grieving process. I think as hard as it is, I think you have to stick it out for a period of time and feel it. And I think that, the aloneness can be alleviated by a support group and being around people that you feel comfortable with and talking with. But I would caution quick movement away from the environment. I hope that was helpful. Yeah. Anything else?
Oh, let me take a look. Yes, so are there other ways or different methods to use in supporting a friend and colleague who is dealing with the death of a loved one that resulted from a very violent situation?
I think showing compassion and listening and expressing the severity of that loss and how difficult it must be. I think directing that person to an environment that is specifically exists for being able to express those feelings. In other words, I would um, provide, a foundation of acceptance and support, but wouldn't I would be afraid to kind of take on too much of that because professionals are more have the experience in how to hear it and witness it without taking it too much to heart personally. So I would, as I say, provide, a loving environment of support at the same time as suggesting some resources that are specific to that experience. It can be hard on those of us that, can take on too much. You can get, vicarious traumatization, and better, it left to the professionals to do the hard work. Anything else?
Yeah, one more question. Is
Okay.
it healthy to have denial for any length of time?
I think denial initially is an adaptive coping mechanism. I think we really do kind of, it's a shield. Um, I would, I would gauge, how long you stay in denial. I mean, if it's more than, a month or so, and without, you know, experiencing another phase intermittently, like anger or, um, depression or another kind of emotional phase of loss. Uh, because you don't want to get stuck. I mean, we have to move through these things, and it'll only have to be accomplished later, or you won't be able to move forward and enjoy a new beginning or a life. And I think sometimes, we have to know that it's not disloyal to move forward. It's okay that you're not honoring the loss by continual grieving or denial. So I think it's being aware of what our emotional state is, if our denial is affecting our work or our other relationships or our ability to partake in activities, then we kind of might need to reach out, come talk to somebody. I hope that was helpful. Anything else?
Let me take a look here. Yes. Okay, one more question.
Okay.
The anger feels intense and irrational, not at any one thing or person, just everything and everyone. What helps with that?
I would say, if at all possible, exercising, journaling, ways of letting things out, um, making sure you don't hurt yourself or somebody else, and understanding it's part of the process. And if it becomes all consuming and starts inhibiting other things in your life, then I'd come talk to somebody, or I'd join a support group about it. It's a natural human response. It's just how much room does it take up for you? Physical, physical stuff is helpful again. Exercising or dancing or aerobics or running or fast walking or bleeding off, that kind of thing. and watching yourself talk, as you move through the process. Anything else?
Let me take a quick look. I think that's everything as far as questions.
Okay. Well, thank you so much for the thoughtful questions, and thank you so much for listening today. Bye for now.